My name is Trisha Garrity, and this is my fourth speech, my persuasive speech. The title of it is Elective Cesareans, Its Convenience versus Safety. Alright, before I start my presentation, I think it's vital to my presentation to establish a common ground with you really quick. I am currently in my 39th week's gestation on my second pregnancy. My husband, unfortunately, was unable to be there for the first pregnancy of our daughter due to deployment in Iraq. Some things that I can say about this pregnancy is that it's certainly much more uncomfortable than the first one was. I have a lot of back pain, swelling in my hands and feet. My belly feels like it's not even strong enough to hold this baby up anymore. I'm constantly waking up. At this point, it's either to adjust or get up and use the restroom frequently. If I'm lucky, I sleep an hour at a time. I am racing the clock right now to try and get my finals done before the birth of this baby. And I'm still working, and when I'm at home, I'm chasing a toddler around. I don't tell you this to try and seek pity or sympathy, but I'm telling you this to let you know exactly why I can relate to the appeal and attraction of a scheduled procedure as far as the birthing process goes, and why it might be appealing to somebody in my situation. During this presentation, I present statistics, studies, and tests that were used as my sources. These sources come from ABC News, the New England Journal of Medicine, the Journal of Obstetrics and Gynecology, and the March of Dimes. There are some statements that cannot be argued with. These facts are backed up with statistics that have been studied, tested, and proved. And some of these facts include the fact that only after the 39th week of gestation and the onset of labor are there minimal risks to both mother and baby when performing an elective procedure. It is a fact that America is currently seeing a trend in these procedures being performed, and it is a fact that performing such procedures can be life-saving, but also significantly increase morbidity and mortality rates for both mother and baby. In America, 30% of all births come via C-section. More than half of those procedures are being performed without any medical indication, and 36% are being done before the highly recommended 39 weeks gestation. Today, I want to share with you some reasons why it's important to wait until the completion of that 39th week before scheduling such a procedure, and why vaginal birth is much safer and healthier for both mother and child. All right. Health risks are minimum at the end of the 39th week. A baby is considered term at 37 weeks, but not full term until the end of the 39th week. When they determine your week's gestation, they do it by estimated due date. Your estimated due date allows for a verbal allowance 2 weeks prior to or 2 weeks after that due date is given. The gestation of the baby cannot accurately be determined until after the baby has been born and been seen by pediatricians, and all the measurements and weights have been done by the pediatrician. I got this information from a labor and delivery nurse who's been a labor and delivery nurse for 32 years, that's Linda Garrity, during a birthing class, and it was verified by one of the top medical staff for the labor and delivery floor at Methodist Hospital, Dr. Sober. If you don't know the real gestational age of the baby, some things that can happen is when scheduling a procedure at, say, term, which is 37 weeks, the baby can actually be found after being born that the baby was only 35 weeks. These babies that are being born between 34 and 37 or 36 weeks are termed late preterm. Now, late preterm babies, according to the National Center of Health Statistics, make up more than 70% of the premature babies that are being born right now. A study that was conducted by the March of Dimes in 2008 found that the singleton premature births were almost entirely made up of the cesarean sections that are being performed. These late preterm births account for most of the increase of the premature birth rate, and $26.2 billion in annual societal economic costs was being spent in order to take care of these babies in the United States alone. Those costs include medical costs, educational costs, and lost productivity time. Health risks for baby. When a late preterm baby is born, these babies can weigh between 4.5 to 6 pounds. They have poor ability to regulate their body temperature. Their lungs, liver, and brain aren't fully developed yet. If they have underdeveloped lungs, some of the illnesses that they face are things like respiratory distress syndrome. What that is there's a protein in your lungs called surfactant, and when that protein is not adequately developed in the baby's lungs and there's not enough present, the baby has a hard time breathing on their own, or they may not even be able to breathe on their own, and they need to rely on assistance for that. Apnea, chronic lung disease. Chronic lung disease is water in the lungs. It causes swelling and scar tissue to develop, and that can also be a long-term effect on the baby. Most of these children with lung issues have issues requiring ventilator support early in life, and respiratory illnesses are common later in life. The liver, if the liver is underdeveloped, the babies are not able to adequately remove things, waste in the blood like bilirubin. Bilirubin is what causes jaundice, and excess of bilirubin increases the yellowing of the skin and the eyes. And if it's not removed in adequate time, it can lead to brain damage and death eventually. If it does get bad enough, they have to do a special blood transfusion to get the bilirubin out. If the brain is underdeveloped, which is most common, the baby may suffer some learning and behavioral issues. It's also been found that the baby is It's also been found that in late preterm infants, there is a 3 times likelihood that they will have cerebral palsy. Other things that happen later in life with adults is mild disabilities and the earning of lower wages long term. Health risks for mother. A mom may have maternal hemorrhaging during the operation. She might need a transfusion, and the hospital stay is going to be longer for her. She could get an infection from the incision due to poor cleaning habits after she's had the baby, blood clotting issues, negative reactions or allergic reactions to anesthesia or misplacement of the epidural, or it's even possible, rare but possible, to have severe damage to some of the organs during the actual procedure itself. There are many benefits to vaginal deliveries. In vaginal deliveries, the recovery and stay is much shorter. There is a decrease in possible issues with subsequent births. The baby has a decrease of respiratory issues, a decrease of the likelihood of having allergies or being lactose intolerant. Breastfeeding is much more effective and much easier to do. It's a better experience for both baby and mom. And the mortality rates and the morbidity rates, which mortality is death and morbidity is illness, greatly decrease for both baby and mom when looking at vaginal deliveries versus cesareans. Some reasons that a woman might choose an elective procedure is to decrease the possibility of incontinence. She might be stressed about the pain associated with labor and vaginal birth. Gives her peace of mind about knowing when the baby will be born. Gives her the ability to plan things like child care, what people will be around and present for the baby. And it gives you the opportunity to guarantee that some loved ones are present, especially if you're facing something like an upcoming deployment. According to studies conducted by the Journal of Maternal Fetal and Neonatal Medicine, more than 99% of late-term babies survive. But at 37 weeks, 11.4% require ventilation. That's reduced to 5.6 at 38 weeks and 1.9 at 39 weeks. Today's society is extremely busy. The doctors are busy, the mothers are busy. There's lots of reasons you could justify planning an elective procedure. However, if that's something that you have to do, I ask that you consider and put the health and welfare of your baby first and schedule those procedures only after the completion of the 39th week.